Having a baby is life-changing. It can also be nerve-wracking with so many things to worry about.
CBS 2's Dr. Max Gomez is here with how mothers may not be getting all the advice they need from their pediatricians. Doc.
That's right, Maurice and Christine. New moms get tons of advice from their mothers and grandmothers, from other moms, from the internet. Trouble is, a lot of that advice is outdated or it's been proven wrong. Pediatricians are the best source, but a new study finds moms aren't always given doctor's orders. Duke is Carrie Ann Hong's third son, and she says her pediatricians have always offered good advice.
They always have said, due to the risk of SIDS, to put the baby to sleep on their back and to not sleep with the baby because you could roll over on the baby.
But a new study finds not all physicians are giving new moms critical advice on current health and safety recommendations.
But sometimes in today's healthcare system, a lot of physicians may find that they just don't have as much time as they want, and that they're often rushing between patients.
The study in the journal Pediatrics surveyed more than 1,000 new mothers. About 20% said they weren't offered advice on breastfeeding or told to place babies on their backs to sleep. More than 50% say they weren't told where infants should sleep.
As a physician, we can't assume that our patients already know what to do. I hope this study is a wake-up call for pediatricians to slow down and make sure that they effectively communicate information to new families.
Carrie Ann says with guidelines always changing, it's important to ask Duke's pediatrician questions.
It really helps to have someone that can explain those things and be supportive.
It's important for moms, especially first-timers, to write down the questions they want to ask their pediatrician. Experts suggest a few of the most important things to ask.
Parents should ask about the feeding patterns, what to expect of the baby, whether how many wet diapers, what is the stooling pattern, what's the color of the baby. Sometimes jaundice is also an important aspect when babies are on breast milk.
Now, pediatricians point out that there are often cultural differences in baby rearing practices, especially when it comes to sleeping. The so-called co-sleeping with baby in bed with mom and dad is common in some groups. Pediatricians say that can be dangerous. Put babies to sleep on their backs in a crib or cradle, and that reduces the incidence of SIDS or accidental suffocation tremendously.
Such a long checklist.
Yeah, it really is, but ask the pediatrician.
There is no certain manual, though, is there, out there? It's
None.
So different for every family.
Ask your doctor.
Every baby to baby.
Absolutely.
Right? Makes you want to have another one.
Oh,
geez.
No sleep. No sleep. Just ask Lonnie.
Tell me about it.
Thank you, Dr. Max.
2-year-old is enough. Thank you, Doc.
By the way,